Supportive Release, Lessons for Community Reentry from Cook County Jail. Thanks everyone for joining. We have a really exciting panel lined up for you today, and I'm very happy to be moderating. I'm Natalie Warren from the University of Chicago Health Lab, and I helped coordinate some of the research for this project. So how things will go today, I will ask our panelists to go and do a round of introductions, and then I will give a bit of background on what the Supportive Release Center is, in case you didn't read the event description, or just to give a bit of background. And then each panelist will have a little bit of time to speak and to do some questions. So if you have a question for an individual panelist, please just put that into the Q&A while they're speaking, and then I will moderate those questions to them. If you have a question for the whole panel, we'll do kind of a round robin at the end when everyone can discuss. So you can save those questions for the end, and we'll kind of open the conversation up. So one other just sort of note is that one of our speakers, Alicia Osborne from TASC, couldn't be with us in person today. So she recorded sort of speaking points in advance, and I'll be sharing those as well as her video introduction. So let's kick it off. Marianne, would you like to introduce yourself?
Sure, I am Marianne Kelly. I am the Deputy Director of the Sheriff's Community Resource Center. And at the time of the Supportive Release Center project, I was the liaison between all the different collaborating entities in the Sheriff's Office.
That's great, thank you. Pam. I think Pam might be having some internet trouble. Rachel, would you like to go, and we'll come back to her.
Sure. Hi, everyone. I'm Rachel, and I am the research analyst at the University of Chicago Health Lab that's been working on a lot of the outcome research for the participants in the Supportive Release Center study.
Thank you. Pam, were you able to introduce yourself? Okay, I will briefly introduce Pam. She is, I hope I get her title right, but she's the clinical coordinator for TASC, who is working at the SRC. So our sort of boots on the ground, leading the clinical team that staffed the SRC all day and all night and recruited people at the jail to participate. And real quickly here, I will switch my screen share and play Alicia's introduction that she recorded.
Good afternoon, everyone. I am honored to be part of the conference at LH this year. My name is Alicia Osborne. I am the Director of Business Development at TASC, and my role associated with the Supportive Release Center was the Director of Operations from its date of inception until its closure date. I hope you enjoy the day.
Cool. Pam, anything you would like to add? Are you able to share? Still having trouble. Okay. Great. We will jump right back in then, and I'll give a little bit of background on the Supportive Release Center. So just to frame the problem, 2 out of 3 jailed Americans in the US is a person with a diagnosed mental illness. This isn't to say that mental illness causes is a risk factor for crime, but that people who have mental illness are more likely to have experienced trauma that is a risk factor for committing a crime. This is really a public health emergency. There are more people in jails and prisons in the US being treated for or with mental illness than there are being treated for mental illness in hospitals. And so we can frame mass incarceration as a public health problem. It's especially clear when we see the cycling that happens through jails. Often people who do intervention programs for mental health in incarceration are doing those in prisons, but because jails have so much turnover, people cycle in and out. it's actually a much higher touch point. We can interact with many more people if we intervene in jails rather than in prisons. In Chicago, where the Supportive Release Center program is taking place, about 70,000 people move through the jail every year. And on an average day, it has, before COVID, on an average day, it would have about 8,000 people at any given point. We found that immediately upon release from jail, people are the most vulnerable. When they leave the jail, they might end up hospitalized or in a medical crisis or a mental health crisis, or worse. So the Supportive Release Center is a program aimed to break this cycle and have a place for people, a soft landing for people to go when they're released from the Cook County Jail in Chicago. This is a place that they can get sort of immediate services and have their immediate needs met. They can have a hot meal, take a shower, do laundry, that kind of thing, as well as getting connected to longer term services like mental health programs and rehab and job training programs, all those kinds of long-term things. And then hopefully back out into the community. They're set up for success with those resources that they needed. So as I mentioned, more people with mental illness are incarcerated than are receiving treatment in hospitals. So this is a collaborative effort. The Supportive Release Center was created 4 years ago by a coalition of people whose logos you see here. The Cook County Sheriff's Office, who's represented on this call by Marianne, TASK, or Treatment Alternatives for Safe Communities, represented by Pam and Alicia, the Heartland Alliance, who unfortunately couldn't join us for this conference, but we're doing some long-term care coordinating for the individuals from the SRC, and the UChicago Health Lab, who helped with research and evaluation of the program. So that is our introduction. Pam, are you able to share now? We can turn it over to you. If you're not, we do have a recorded session. She's still, okay. All right, so I'm gonna play a recorded interview that Pam and I did on Thursday, just in case this exact thing happened. 1 second while I jump over there. Oh. We're all learning how to do virtual conferences all at once, so thank you for your patience. All right. And I think you have to accept.
This was reversed.
Okay.
We looked
from originally.
Thank you so much, Natalie, for asking that question, because that's the most important question here. The idea for the SRC came from the client themselves. I come from where you sit down with a client and you usually tell them what they need. But this was reversed. We looked at, we need to ask the client, what do you want? What would you like to see yourself doing, going, being when you leave the Cook County Jail? What are your wants? What are your desires? And from that, we created a survey. And the survey came from them. They are the ones who helped us make this SRC and make the beginning of the SRC.
That's wonderful. What were some of the things that that came up on that survey, the needs and wants?
What do you have a place to go when you leave here? Where would you like to go when you leave the Cook County Jail? Would you do you have an ID? Would you like to get an identification ID when you leave? Would you like to have employment when you leave the Cook County Jail? Would you like to be reconnected with your family when you leave the Cook County Jail? Those kind of questions. And those questions you don't ask that client that ordinarily. Ordinarily, we tell the client, this is what you need. I'm looking at your rap sheet. I'm looking at everything you've been through. And now you're leaving jail. This is what I'm going to do for you. So we had to reverse that and ask them, what would you like for us to do for you?
That's so good. Yeah, it sounds like right from the beginning, it was directed by the clients. How do you get people to engage with a program that's voluntary? It sounds like there's probably a lot of buy-in already, but how do you get people to actually go to the SRC?
That's the $100,000 question. It was very difficult. And let me tell you why it was so difficult. I come from the court system with TAS, where we worked with mandated clients. And so it was a mandated mentality, mandated program. And mandated means if you don't want to buy in, you go to jail. So you got to buy in. So the difficulty came in, how do I switch how I think about this engaging a clients? And that's what I had to do. That one word you said, engage. I had to think about, how can I engage a client who come from a non-engaging environment, Cook County Jail? How do I engage that person? I am here in a place that all they want to do is leave this non-engaging place. So it was made up of a team, my team. And I have to thank the care management gods, because I had a heck of a team. I had a team inside the Cook County Jail. I had a team inside the SRC for the morning shift, evening shift, as well as overnight shift. And then I had 2 drivers. That team was the driving force. We learned how to engage. And it started in a with pulling that client here. You are now in a safe place. We had to get permission from the sergeant to give them snacks, water, because those are things, I mean, it's just like Maslow's hierarchy. Water, food. That was the engaging piece. Very important. The next important engagement piece is every client gets a phone call on their way out the door. But that phone call in our office was the total different. That was engaging the family. We had to speak to them and tell them, look, we have your loved ones in our office and we're going to care for them on their way out the door. We want to engage them. So please help us engage your loved one. And so that call was part of the engagement process. Then when they had the buy-in and went over to the SRC, then I had that team. They were so loving and caring. And when that client stepped in that door and saw what they saw, that's when you can show probably, I'm sorry. When they saw the SRC and the smell, the look, and the team that was waiting on them with open arms, that was the next engagement process. And they told them, sit down, relax. What would you like to drink and eat? And that is how we engaged that client. And then it went on and on and on. Whereas they were comfortable, they was able to open up and talk to us. And that was the part. And so now we engaged them. They volunteered. This was their buy-in, and they wanted what we had to offer because they knew we were going to help them.
That's great. I remember, hearing some stories about sort of your engagement methods as well, Pam, when you would say, what do you think your mom would want you to do? Do you think she'd want you to get to take care of yourself and to get, the things you need right now? So that's great that you really engage the families, in that way.
Yes, absolutely.
What were the key components that made the SRC possible?
So again, I have to defer to my team, first of all. The team is what made up this key component that made it work, because I had to have loyalty to the client, engagement skills. I had to make sure that you came to work because we were a 24/5 program. I could not, you know, work this without that team. And the other component was my team was an eclectic bunch of people. They came from all walks of life. I had interns from SSA, University of Chicago. They came from all walks of life. And then I had my staff, and they knew the community. So first of all, it was diverse population, mostly Black and brown, but we also had that other mix in there where we had to know every side of the town of Chicago, the suburbs, and we had to know the services that they offered, and we had to have the linkage and buy-in of them. And then give the client what they needed. So some of those services was substance abuse, housing, getting a state ID, getting a birth certificate, getting a job. Do you know that some clients just wanted a ride home?
Mm.
So those were the key components. We had to give them what they wanted. And they just wanted a shower maybe. And that was another key component. They would come in and they would be able to wash off all the woes and problems that they had in that Cook County jail. They would wash it off and they would get their clothes washed. That was a key component. And they could leave up out of there and their families would say, whoa, is this my son?
Mm.
I would say that when they get out of the shower. Is this the client we just brought over? Because that key component made it successful. And they knew that they were going to be well taken care of by us. Those are some key components.
That's incredible. And we can tell from the stories that the clients wrote and the thank you notes even that they wrote to you that they really felt that care and that warmth from the team. That's really great.
Yes.
What was one of the most surprising things you learned in the process of working with the SRC?
Well, I had several surprising things, but the one that was most, we did not know that the word about the Supportive Release Center would spread like wildflowers, meaning the client would leave us and they would tell others in the community. These people were not even incarcerated. We would have people come and ring and knock on the door with suitcases in hand, with clothes to say we're homeless. We heard that you would help us.
Mm.
In the middle of the night, in the morning, people would even walk from the Cook County jail, not knowing that they needed to take a survey, but would walk over because someone else told them, hey, those people over there in that trailer, they call it a trailer, will help you.
Wow.
That was the most surprising thing that I just didn't understand it. I was like, oh my God. People just want this. They didn't even come from the Cook County jail.
Mm-hmm.
So we had to devise a way on how to help those people and not let it interfere with the research. And we did. We were able to help others that walked up to that door and knocked on it without interrupting our research. And that was the most surprising thing, that I didn't know we would learn to do that, have to do it, or there was a need to do it.
That's incredible. Thank you for sharing all that. And thank you for serving these, thousands of people right through the SRC.
Thank you. Thank you.
All right. Okay. Thank you, Pam, for having recorded that. I'm sorry that your internet is giving so much trouble. Yeah, that was really great. I am now also going to share the pre-recorded video from Alicia. It just, looks like I'm doing a bunch of quick changes in different shirts, talking to all these people. But then I promise we'll have some live remarks from Rachel and Marianne after that. So Alicia also works for Task, and we'll be sharing sort of the higher level perspective of working with the partners, the service providers that are needed to provide what these clients need. So I will pull up this video now. Alicia, thanks so much for joining us and for recording the session in advance. We're really excited to have you here. Just right off the bat, we know that collaboration is a big sort of buzzword in this space. What did collaboration really look like for Task in the SRC process?
Well, collaboration is key. With this process between all of the partners that were associated with the SRC model, there was true collaboration. There were daily touch bases, scheduled meetings, weekly meetings. Everyone was very clear of each partner's roles within the project. We were extremely real with one another. Always with the intended outcome and purpose of getting the issue solved and doing what we needed to do as a collaboration to be effective so that the clients that we were serving would receive the quality care that we were intending to deliver.
That's great, yeah. How was it working with a research team alongside the service providers? How did that integration happen?
Well, the integration started from the beginning, and I think it is very fair and safe to say that people get into the human service field because they do not want to deal with math and/or research. And here, this project was involved with research from its inception. The staff at the Task SRC were involved in all of the research meetings that we had. Our weekly calls reviewed data. Our staff were accountable at all levels, the direct service staff, supervisor, administrator, director, at looking at our data and seeing what our data was truly telling us, being open to that if we were not seeing intended outcomes, which were proven and visible by the data, that we made the necessary tweaks, and always looking at the trends that we were learning from the clients. We could take age group, for example. And if we were seeing that there was a large recruitment numbers for individuals, just for example, over 50, but not individuals under 30, what could we do differently? What could we say differently? What needed to change so that we can continue to recruit people and get all that were eligible and interested and opted into the SRC there so that they could receive the program model and receive these services.
That's great. It sounds like it really was an iterative process. What were some of the challenges working with the service providers needed to provide the range of services that these clients needed upon release?
Something that just is very apparent is that the release time of individuals that we were working with was at a non-traditional sort of community service provider intake time. There were multiple discussions with different service providers that Task would have to ensure and work out and work alongside if, by example, we were able to transport the client to provider A, provider B. Would they be willing to be flexible with their intake time? As many of you know, people leaving county jails don't often have their appropriate state ID and personal belongings, et cetera, with them. So making accommodations and being flexible at time of intake to be understanding of the individual detainees who are being released, of that what they didn't have with them, not have that be an additional barrier to getting into service. There were lots of ongoing discussions. We were open to hearing from providers what was working well for them. And just really ongoing process reviews of what needed to change, what could change, and things that couldn't change, how could we work around or that our clients weren't missing out on an opportunity, and that we were meeting the provider's needs to get them there. And definitely transportation was a big, big part that really ensured linkage to the next point, and that we were able to drive someone to a service provider from the SRC with great collaboration with the Cook County Sheriff's Office, with transportation assistance there. We knew that the clients would get there and get there safely. And then we always confirm once a client is on site with the provider that they arrive, were there any issues, and be available for any follow-up needs that were attached to that client. Another key point was transportation to different county clinics or pharmacies for individuals to pick up their medications, whether primary medical medications or psychotropic meds, so that when they arrived, the provider, they had what their their prescriptions were, and they had those on hand.
That's great. Is there anything else?
I'm sorry I couldn't be there in person today. If there's questions, please feel free. My contact information is aosborn@task.org. Any questions that you may have, please feel free to reach out to me, and I'd be happy to speak with you.
Thank you so much for your time, Alicia. We really appreciate it.
And Natalie, thank you so much for your partnership.
Great. So Alicia was gracious enough to share that, record that in advance to share with us today. And now we've heard from two of the service providers with TASK about sort of how things looked in the SRC. So now we'll turn to Marianne to hear about the Sheriff Office collaboration. Marianne, could you just tell us what the vision was for the SRC from the Cook County Sheriff Office side of things?
Sure. So in order to do that, I have to give you a little backstory though. So in about 2012 to 13, our sheriff began noticing the increasing number of individuals in custody dealing with mental health issues. He knew that this was primarily because of the closing of several mental health clinics within the city, but he didn't really know how to intervene, and kind of thought maybe he needed to up his game and become a mental health provider. So kind of after looking at the numbers and seeing really that in fact, the jail had become the largest mental health center, inpatient, if you will, in the entire state of Illinois, he decided to begin building a structure that would break the cycle of incarceration for individuals, but also by doing that through creating programming and then also advocacy and his work speaking out publicly. With that, he created an office called the Office of Mental Health Policy and Advocacy, which I am proudly one of the two founding staff members of. And the purpose of that program was to provide in-custody treatment, rapid mental health assessments, advocacy, discharge planning for individuals who are in our custody, dealing with mental health issues primarily, but really pretty broadly, lots of things related to behavioral health services. And those initiatives were built not just with the expectation and the hope of reducing recidivism, which I think programming in this environment is usually focused on, but also really on stabilizing individuals when they got out. So, but unfortunately, given the nature of discharge planning in any jail, it's really difficult to do comprehensive, really thoughtful planning. And so he continued to remain concerned about the fact that there were individuals leaving our custody with nothing at that moment of release, and maybe not enough time in a program or not enough time connecting with my team at the time to develop discharge plans, and really wanted to figure out a way to bridge what we tried to start in custody with what a person could receive in the community. And so I think from his perspective and from the perspective of our office, the vision of the SRC was really meant to be that immediate bridge that we had hoped we could be, and kind of saw that maybe we couldn't, to really ensure that individuals who were leaving our custody were going to have a soft landing somewhere, receive all of the services they need, and then really connect with ongoing community providers. And so that's really what I think the vision was, to fit into this larger model that he had as it relates to really not just addressing the decriminalization of mental illness on a larger level, but on a personal level and a treatment level as well.
That's great. Yeah, we know the Sheriff Dart really does care very, very deeply about mental health. Do you think the SRC program changed how community release programs, reentry planning, things like that happen in general for the jail?
Yeah, absolutely. On several levels. The most, I would say, significant to me, at least, is that we've actually, with the SRC and the study wrapping up, the sheriff was very focused on wanting to have, to make sure that didn't go away, because was really, really pleased with the space that it held and the gap that it filled for us. And so he tasked, again, me and someone else, to create another program, and that's called the Community Resource Center. And that is really built on the foundation, everything that Pam and her amazing team did to engage people, to provide them with the services they need, to connect them to everything they need, to be that, to be present at that very critical moment in time when a person is being released, particularly individuals with severe mental health issues, substance abuse issues, housing issues. But I think, other than sort of being the baby, or maybe the parent really, of the Community Resource Center, I think what the SRC project really did for the sheriff's office is it changed the way in which we collaborate with other partners, whether that's a treatment partner, some level of collaborative as it relates to assisting individuals in our custody, and or just partnering on things like other studies. So I think it really did a great job of showing how collaboration is necessary. I think that all of us in what we do, particularly on the law enforcement side of things, sometimes only see our own side of it. But this collaboration really forced us to expand our idea about how we work with other entities in an effort to best serve those that we work with. And so I think even from that, we've been dramatically impacted, not just within the unit that was sort of the partner to Pam's team, that's the discharge unit, but across the jail. We've really, I think this project and sort of, word on the street about this project really helped officers and sworn staff see the reason for the direction towards mental health programming and advocacy, and the importance of assisting individuals in our custody who are dealing with these, mental health concerns or housing, and that it is a lot more than just saying, well, we don't want you to come back because we don't want you here. Like, it's about helping individuals really improve the quality of their life and get all the happiness and the wonderful stuff they deserve. And that kind of spread. So it definitely started in discharge. I have the squad behind me. We were very, very happy to always provide transportation. We have a picture of an officer who was kind of the driver. And what's so interesting about that piece of it is that now it's just spread to the point that everyone thinks of, there he is, Officer Torres. Everyone kind of just thinks that the discharge unit is part Uber. I'm not sure, but those officers, so it's kind of changed just in that way, that there's not only the acceptance of programming, but there's the buy-in, and there's the, hey, let me help. I mean, Officer Torres is incredibly proud to be the resource driver. And I have to say, the first time I met him, I don't think I ever thought I would say that about him. So it's definitely influenced the direction of lots of aspects of the way that we program and the way that we, interact with individuals in our custody. And it's helping to take a broader lens that is a little more rooted in social service and community linkage and support and help and psychiatry and psychology and therapy and all of those wonderful things that I think many individuals in our custody desperately need stabilization around, otherwise they do come back. So yeah, I think it's absolutely, yeah.
Wonderful. Yeah, thanks so much for sharing all of that. I think, you know, you touched on with Officer Torres that he was so excited, maybe not at the beginning, but after a while was so excited to be helping. And I think that's a common thread with the SRC. Everyone who is involved with this project is like, oh my gosh, can't stop talking about it. Like, what an exciting thing.
Yeah.
So that's great to hear.
Yeah, and I openly admit that I didn't want to have anything to do with it in the beginning either. Mostly, and I will say this to everyone, I didn't love the idea of an initiative that started at 5 o'clock at night. I worked 8 to 4, but I have never. I honestly, it's one of the most wonderful parts of my career so far, was to be involved in this project in any way, shape, or form, and all that it's done for all of our relationships together and our continued relationships with Task and University of Chicago, and thinking about, you know, taking an approach to studying what we're doing. It's been tremendous.
That's great. And just a note for our panelists, that reference to starting at 5 p.m. is a lot of people are released from the jail in the evening, right? Which is part of what makes it such a critical time for them to have somewhere safe to go and a safe place, a way of transportation. Thank you so much, Marianne.
Thank you.
Great. If anybody has questions, please feel free to just be submitting those at this point. We have one more speaker, and then we'll open it up to everybody for sort of a roundtable discussion. So we've heard now from Marianne and from the 2 folks with Task. Rachel is going to talk a little bit now about the University of Chicago Health Lab's involvement with the research at the SRC. So Rachel, tell me about what the research was, why you did this randomized controlled trial.
Sure. So we conducted a randomized controlled trial in the Cook County Jail for the Supportive Release Center. And we decided to do a randomized control trial because that is the gold standard of evidence. By randomly assigning who get intervention, you have 2 groups that have the same observable characteristics on average, like race and age. And then any change that you see after the intervention, you can make causal claims that the SRC intervention did X, like reduced rearrest or improved health outcomes, et cetera. And now randomized control trials have limits. They can't capture the effect of how Pam and other staff at the SRC made participants feel. And that's just as important as the rearrest outcomes that we can see in the data. But taking this highest standard of evidence to funders and policymakers, saying we know that this works, can help fund programs and make them permanent, like Marianne was talking about, rather than just a trial. Nothing sort of brings credibility to an intervention as well as a RCT does. And it also lets us know what isn't working so we can best utilize our resources. Like you heard from Alicia earlier, the research can identify issues and be used to make real-time adjustments to service provision.
That's great. How did the randomized controlled trial work in the jail? What was that process of randomizing and everything?
So the University of Chicago Health Lab employed research assistants who were in the jail starting in the afternoons, and they stayed until everyone was discharged. So it could be 10, 11 at night. And those research assistants pitched participating in the study to the men who were waiting for their discharge to process. And if they were interested, the research assistants obtained informed consent from all the participants, explained the study and what would be required of them and what sort of information that we would be collecting on them. And they also administered the eligibility survey. And then for the people who were eligible, they randomly assigned each person to either the treatment or the control group. And like you heard, both the treatment and the control group met with task in the jail, and then the treatment participants were offered a ride to the SRC.
Cool. That was like a snapshot of the whole randomized controlled trial process. I'm sure we're all wondering, what were the results that were found?
Yeah, so we're still working on our final analyses, but our initial analysis has found that being assigned to receive the SRC, so not even necessarily going to the SRC, reduced the risk of rearrest for older age groups, so men 46 and older. And this effect was strongest immediately after the intervention, like 1, 3, 6 months after, and then it fades out over the year of follow-up that we looked at. And so there might be a few reasons why we're seeing the effect only in the older age group and not in the younger men. It could be that the SRC is just, the intervention is best suited to older men, and younger men might need something different. But it might also be because these older men took up the SRC. They actually went to the SRC at much higher rates than the younger men. So we don't really know. And to understand the mechanism of this better, then we could do future RCTs to test different interventions or different ways to increase uptake among the younger men. And this issue of uptake is extremely important because an intervention that works doesn't do any good if people don't go and don't take it up. So if we want to have an impact, then we really have to pay attention to this issue of take up. And in addition to rearrest outcomes, we are also going to be looking at housing and health related outcomes to give us a fuller picture of the SRC's effects. And we hypothesize that there may be bigger impacts in these other domains. Again, because of the demographics of the folks taking it up. Older people just have lower rates of crime to begin with, so it might be more difficult to see an effect there. But we might be more likely to see an effect with healthcare and housing because that's where the needs are most.
That makes a lot of sense. Do you have any inklings about what might help with uptake? I know you were mentioning like it's definitely important to have people there if the program's going to work. I remember hearing about pizza as an option.
Yes. So towards the end of the study recruitment and right before COVID-19 hit, sort of in late February, early March of 2020, we started testing some different ways to increase uptake. And yeah, one of the biggest suggestions that we had from the staff at the SRC was people really wanted good food when they got out of jail. They didn't want, ramen noodles or Easy Mac. They wanted something good, and specifically they wanted pizza. So we tested providing pizza to see if that would increase our uptake. And Natalie, you might remember better than I the results of that, but.
I don't think I've actually seen the results yet, so I'm excited to hear when we find them. But I do remember that our staff tested the pizza first to make sure we were serving good ones, and that was what I enjoyed the most.
Yes, only the best.
Yep, that's the research method. You even have to test the pizza before you can serve it to anyone. Well, that was great. Thank you, Rachel, for sharing that perspective. Anything else on the research side?
Nope, but I'm happy to take questions.
Great. Well, we'll open it up to the whole panel then. I think Pam might still be having some internet trouble, but if anyone has questions, please feel free to put them in the Q&A. But we'll just kick things off, maybe talking about sort of the common thread that we've seen through all this, which was the strong teamwork and collaboration and the close sort of working relationship between these organizations. So I would love to hear from everybody just sort of what the richest part of that collaboration was for you. What were the sort of meaningful moments or the surprising things about working together with these very different groups?
I can go. I think for me, I was the most special aspect of this partnership and this teamwork has been that I came to feel that we were one team. There are so many different things that go on, particularly, probably across programs and different agencies, but it's always been very difficult to connect with another agency on a project and have that one project mean that you're one team and not 5 different entities trying to get their piece of the pie out of that, whatever that thing is. This was truly a collaboration where I think, I always thought of us as one team. I never thought about, well, Pam is from Task and I'm from the sheriff's office. So somehow that makes us different entities on this one team. And that wasn't the case at all. It really was a united front, which I think also assisted with that buy-in. That also, I mean, I can't even tell you the turnaround that the officers have had. I mean, I saw it go from, just an unwillingness to be a part of this project to the point that they didn't even want to let me go and get involved. Like, oh no, you can't come to this part of the jail. What are you talking about? I can go anywhere. But just in an effort to just try and shut it down in any way they could, to them being super excited that the CRC is coming or is here and that they can continue to be a part of that kind of work. That's been amazing.
That's great.
Yeah, and Marianne, like you were saying, the change in the officers, I obviously was not in the jail day to day, but we did keep track of sort of which officers were helping during the randomization process. And you can see that there were a few that really stepped up, and like every time that they were scheduled, they were there helping out, and I could see their names come up again and again. So it was fun seeing that. And yeah, Torres was definitely one of the names I saw a lot. And then for me, I think the other thing that really added richness to this experience for me was hearing from Pam and the rest of the staff at Task, the stories of the people that just felt like they were taken care of and their needs were listened to and they were heard, and the SRC just provided this safe space for them. I spent a lot of time looking at the numbers, but I think that like I said, there are a lot of things that the numbers can't tell us. So I just really loved hearing those stories from the folks on the ground.
Absolutely. Yeah. We have some of those stories in a handout attached to the HUVO link on the LAPH conference site. We made it sort of a booklet of testimonials and stories last year, so everybody can look at those if they're interested. We just got a question from the audience about what kind of community feedback have you received, and do more providers have more providers sort of volunteered to be a part of this kind of initiative? Looks like Pam is still having trouble. Marianne, what has the buy-in been like for the CRC? Maybe you can speak to that.
Yeah, it's been tremendous, actually. And I will say the CRC, so the SRC, and I will mix the two up because they're just too close together. But the SRC really kind of wrapped up at the very beginning of COVID and sort of lingered a little bit. And there was a decision prior to, knowing full well the SRC was going to close, that there would be some sort of, something to replace it on our end. And that was something that I began working on before COVID. And then when COVID hit, we decided to just kind of not worry about it so much. We were getting a lot of individuals who were leaving custody and their family members were willing to take them back. And everything was kind of at a standstill with COVID. So it was, we were all like, oh, well, nobody's going to go to treatment right now, or they don't have beds. So we kind of put the CRC off to the side, and then began to realize that actually COVID was causing a huge gap in services for individuals and linkage, and people were even more in need of our support than we had expected. So we threw together, I wouldn't say threw together, but again, I put together the CRC, and the one thing that we were very adamant, the executive director and I, about having in place before we began doing any kind of work with people in the community was a very strong partner database. And so when we got staff finally, their primary responsibility was to vet and reach out to anyone and everyone in the city that we had working relationships with, to not only say, how do you feel about working with this program and accepting referrals from the sheriff's office, but what does your capacity look like now that, we're dealing with COVID? Are you even still open? Has something changed in any way as it relates to your protocols or your intake? And so they reached out to thousands of agencies. And so, and not only did we were able to go in completely comfortable and confident in the partner database we had when we opened September 23rd. But that continues to grow, and the willingness to partner continues to grow, which has been amazing. And so I think for us, we really have had to just sort of insert COVID and its realities into those relationships, and then either building those relationships in an effort to adjust to any kind of losses, or unfortunately we've had agencies close, and so just kind of staying on top of that. But we've had a tremendous response, and we've had a tremendous response to the people that we've done outreach to. So we've spent a lot of time just kind of saying to everyone who's left custody, hey, we're here for you if you need us. Is there anything you need? And we call them a couple of days after they've gotten out, and we're getting a tremendous response from the participants as well, saying not only, yes, there are things I need, and they're not the things we expected initially, like, oh, I need treatment. These are basic need things that people are leaving and because of COVID are having trouble obtaining. And then they're turning around and saying, and, thank you so much for even existing. I can't believe the sheriff's office would call me to see how I'm doing. And they'll admit, I wasn't even going to answer the phone. I was super nervous when you said this is the sheriff's office. So, too, learning from that process, we've sort of changed up our script and things like that. But there's been a tremendously, wonderful response from community partners.
That's incredible to hear. Yeah. I'm sure, if I got a phone call and it was, hey, this is the sheriff's office, I would probably feel a little nervous, unless it was, hey, this is Mary Ann from the sheriff's office.
Yeah. Well, that can be challenging too. We've had quite a few women get angry with my female staff. Like, hey, this is Mary Ann. I'm looking for Joe. Why are you looking for Joe? Oh, no. So we've had a little bit of that. So we're trying to find that happy medium between, this is the sheriff's office and this is some random girl calling some guy who just got out of custody, and we don't know who's going to answer the phone.
Absolutely. Good things to keep in mind, all that sensitivity. Well, that's incredible that, people are really taking up on these services. And I think it is out of the ordinary, like you said, that a sheriff's office would be reaching out and calling and asking to see how people are. So thank you so much for continuing this work on. Yeah, that's really cool. We are out of time. I know that there's another session that starts in 5 minutes. But thank you everyone for joining, and thank you so much, Mary Ann and Rachel, for speaking and for sharing with us today. I think the conference app has a sort of contact and question feature. So if people think of questions later on, I'm sure you can reach out to any of the panelists with those. But thank you so much, and I hope you all have a great evening.
Thank you.
Bye, everyone.